If you want to learn more about the real Belize and listen to local and expat stories of those living in Belize, you're in the right place. This is Belize Talk Radio. Please welcome your host, Belize and international real estate expert, Macarena Rose.
Oh my goodness, I'm so impressed from the outside.
Hi, Macarena. It's good to see you after so many years.
It's been a while since we did the last video and introducing people, of course, to you. But what I find fascinating is this new building is like something just I've never seen. You did good.
Yes, and a lot of hard work and good patience.
Well, patience because it takes long to do it, or you mean patients that come to see?
Patients that come to see us. Well, a lot of good patients that come to see us.
That's because they know that you're gentle. Right? And that means a lot of difference. Most people are not like, oh, I can't wait to go to the dentist, but it's very important, right? Dental hygiene. And your location is like, you were just down the street. So it's so easy for people to go just a little bit further down on Bullet Tree Road.
Yes, it is. And we were trying to find something closer to town, but I think this is a really good location because it's more space for parking and right in front of the San Ignacio Hospital.
And this is a 2-story building. And how many different rooms do you have for consultation?
We have 5 different rooms.
Wow.
And x-ray room, a sterilization room, and a lab.
You have it all. So on a normal day, if someone's coming to see you, if they want to make an appointment, you do what kind of work here? I know you've changed some things that you weren't doing when we did our last interview.
Yes, well, we do all the normal procedures, which are the fillings and cleanings, but now we have specialists that do the root canals and implants, and then we have the oral surgeon that does the impacted wisdom teeth. So,
oh dear Lord. I had one of those. They're not just a little painful. They're extremely painful.
No, he's very good. So as long as you take your pain medication after, he's very quick.
So it's not like going like my friend's story that he went to a dentist and they literally just pulled his tooth out without any pain medicine or Novocaine or anything.
No.
Can you imagine that? Is that even something that someone should do?
No.
I think they would never want to go to a dentist again, for God's sake. So where is this? Listen, I see the consultation room. You said there's an x-ray room. This is the x-ray room.
This is the x-ray room in here.
Oh, what kind of machine is this?
So this is a CT scan and panoramic and a Ceph machine. We just got it last year. It's one of the first here in Belize. And
there's only 2, if I read right?
Only 2 in the country.
And one is right here in San Ignacio.
It's right here.
Wow. And people laugh because, when I moved to Belize over 20 years ago, people were like, you're moving where? Because everybody knew some other places in Belize. And I'm like, I'm moving to San Ignacio because it's the best place. The West is best, right?
Yeah, it is. Definitely.
And because you actually grew up here.
Yes.
You're not like a transplant, like, 20-year transplant. You grew up here.
Yeah, since 1981. My parents moved here, and this is home.
This is home. Yeah. And we're very blessed that you went to Chicago, correct? Or
I was in the States for a few years.
For medical.
But then I moved back in 2010, and then I've been here ever since.
To open your clinic, right? I mean, it's amazing. We're so blessed to have you right here. And people don't have to go, to Belize City or that's, it's a lot easier.
Yes, it's a lot easier. And then we try to provide all the services here.
Like this.
Yes, like this.
That's amazing. That was impressive to see the x-ray room, but I'm not sure. What kind of machine? You said it's like a CAT scan machine?
Yeah, it's a Comb B, so it captures the image in 3D, and then you can do surgically guided implants.
Oh, you're kidding me. That would be a heck of an asset for this country.
Yes, it would.
Wow, that's impressive. See, this to me is why, when people ask about medical tourism or they want to we have good medical care here, I can say in the last 20 years, our medical care is off the charts. and being able to share with them that they can come to a dentist with state-of-the-art equipment. I mean, it's just beautiful. And bless you, because this could not have been easy to make all this happen.
No, it wasn't easy, but one day at a time, and here we are.
Yeah, that's that. You say that so humbly, but I've watched even people building process over the years, and to get all this equipment in and get established. So tell me, you have another dentist also here, right?
Yes, I do have a colleague, and she works here 3 times a week, but I just asked her if she can work a few more days because we need extra hands. And her husband also works here.
Wow, so it's a lot. What about you also bring dentists in, correct?
Yes, specialists.
Okay.
Specialists.
And where are they from? From Belize?
No, they come in from Guatemala City. So they come in maybe every 2 months, and we do with some teeth removal and root canals and the implants.
Those heavy-duty things, right?
Heavy-duty things.
A little muscle there. Oh, my goodness. So if someone's deciding that, let's say they have their children and they want to start coming to the dentist, do you start with children, and do you do children here too?
Yes, we do. They can come in as soon as they get all of their teeth, which is usually at 2 years old. And then we can do preventative on them before anything gets bad.
What's it like to work on a 2-year-old in their mouth?
Well, we don't work on many 2-year-olds.
I can imagine they'd be all over the place.
Yeah. Well, now that we have the TV, it actually helps a lot with the kids. You put on like their special cartoon or a movie, and
Is that what this is for?
yes, and so they just want to stay because they want to finish watching their favorite cartoon.
There, so smart. Does this work on adults too?
Well, we put relaxing music usually for the adults or whatever they want to watch.
Don't put on some happy, I put on comedy on so they would be all happy and good and juju. So this location that you chose on Bullet Tree Road, I find it to be very accessible for everybody, location-wise, for sure. Do you get a lot of people that are outside of the Coyote District that come to you?
We do. I actually have patients from all over the country, from PG, from the city, or up north. And a lot of expats come as well. A lot of them live here during the winter, and so they do their dental work here. And we have people that just come for dental work as well.
I'd have you do anything because you're so gentle. You always want someone gentle working on your mouth, right? And highly trained, of course. But I'm very impressed with this. This is impressive what you've done. Kudos to you.
Thank you.
Yeah, that's all. Thanks for doing it because we needed something, in Cayo, right? And you came back, how many years ago?
2010.
2010. I'm so glad you came back. So that's when I came back. I moved in 24. So yeah, it has been a while since we did a video, huh?
Yeah. I don't remember when it was. Was it like 2012 maybe or 2011?
Probably 2012. 2012. We'd have to go back and look. Yeah, it's been a while. But what you've done, how long has this been open now?
It's going to be 2 years in October that we opened.
I knew it's been a while, but I have so many friends that have come to you already. And I'm like, oh, yeah. And when I told them I was coming to do an interview with you, one of my other friends was like, oh, I'm going to see her next week. So I'm really impressed. I'm very thankful that you're here. And tell me what else is you're going to be doing here. Any implants? You're talking about implants or something you're working on? Or
We'd like to do, we do implants, but we'd like to do the surgically guided implants.
That's fascinating.
Yeah.
That's going to be amazing for this country, for people to have that. Is that available anywhere?
Yes. I'm not sure how many dentists are doing it because it's a newer technique. With the latest technology with the cone beam, so everything is planned. You can measure the bone density, how close it is to the nerve, and have everything before the patient even comes in.
That's impressive. That's impressive. Well, we're really blessed to have you here in this area for sure. I know we can certainly share with people that they can run in great hands with you for true. And you do dental cleanings, you do the x-rays, the wisdom teeth extractions, root canals.
Crowns, bridges, partials, yeah. Basically, almost everything.
Okay, it's time for me to finally come. I need to make my own appointment again for sure. And I think it's fabulous what you've done. Kudos to you. Hats off. Because this was, there had to be a lot of planning.
Yes.
And your other place was a decent size, but this is huge. How many rooms did you have at the other place?
We had two rooms.
Yeah, so definitely. Even your waiting room is huge. So this is 5 rooms, individual rooms. And then you're going to be building upstairs too?
Hopefully, yes.
Yeah. I can't wait. Oh, we have to come back and do another one. See what you're doing. Stay tuned. We'll see what that one is for sure. I thank you so much. Thanks for showing us around today.
Thank you.
Do you mind if I tool around and look at some rooms?
No, go ahead. Right ahead. Make yourself at home.
Make myself talk. Well, I was kind of nervous when I got to sit in the chair that I was going to get worked on.
We
But
can
I
go
don't have
ahead.
to be. I don't have to be with you. I am one of those people that absolutely love to get my teeth cleaned because I know that you're supposed to for dental health, right? And education. Maybe we need to come back and do a series with you on dental health. So we can share with people some of the things they can do besides coming to get cleanings at least twice a year.
Yeah.
Right? I could come every other month. But I'm weird.
Or every 4 months.
Every 4 months. Does anybody come that much?
Yeah.
I love to have my teeth cleaned for sure. I really appreciate your time though. Good job. Impressive. Well, so I'm really kind of excited because you said you have something to try out on me, right? Because I grind my teeth so much.
Yes, we have an intraoral scanner, so we're going to go ahead and scan your teeth so we can make you a night guard.
Okay. Really?
I'm just going to lean you back, and then the scene is going to go ahead and start scanning.
Okay, we're gonna start scanning.
Okay.
We're gonna start with the top one.
Okay.
If anything bothers you, you can raise your hand and
Okay.
just need to open.
For the intraoral scanner, we would need to just take a normal impression, a conventional impression with just alginate, which is more comfortable for the patient because sometimes you feel like you're gagging. So with this, we just scan it and then we email it to the lab and then they can go ahead and make it and send it back to us. You're grinding there.
Oh, yes, you can see it, huh? Boy, I need that mouth guard. Good thing she's going to make me a mouth guard. Wow. So all I can say is that people are very blessed if they can find you and they can come to this clinic because it's state of the art and it's clean, it's crystal clean, beautiful. Tell people how they find you.
Well, they can find us, I guess, on Google Maps. We also have a website, and the phone, you could give us a call, and on WhatsApp as well to make appointments, or email.
And it's easy to find her. She's Meg Ryan in Belize, right? So you can put in Dr. Meg Ryan, Google that, and you'll get all of her information. What's your WhatsApp number?
It's 615-7801.
So, of course, if you're not in Belize, you dial the 011-501 and then the WhatsApp number. Thank you so much for sharing. Oh, and your website name. What's the website name?
It's Belize Dentistry.
BelizeDentistry.com. You can't forget that one for sure. No problem. You have a wonderful day. Thanks so much.
Thank you.
I'm going to go tool around and look a little bit more. Is that okay?
That is fine.
Good.